Hello friends, this is a clinical case based discussion. It's on the digestive tract and it's related to the surgical physiology. An interesting one, so watch it. Um, a 40-year-old female was operated upon for chronic acid peptic disease. Peptic ulcer, we can call it peptic ulcer. Post surgery, she developed new GI symptoms. Now, we don't know whether it is related to the surgery on the digestive tract or something else. Now, immediately after meals, she feels hunger, dizziness, sweating, and palpitations. These are the new symptoms post surgery. So, what would be the best advice to alleviate her symptoms? How she should manage her symptoms? If it's a NEET PG question, there will be MCQs. If it's a first prof question, it will be a 10 marker. We will have a look at both of these. If it's an MCQ, you have the options. Just lie down after the meals. Is that the best advice? Or have extra calories with carbs and fats in the diet? Is that the advice you would like to give? Or eat smaller meals of complex carbohydrates and small volumes of fluids? Is that the advice? Or take lots of fluids containing glucose and electrolytes? So, what would be the best advice you think? Well, let's rule them out one by one. Just lie down after meals. She already had chronic acid peptic disease, hyperacidity, peptic ulcer maybe. And if you lie down after the meals, immediately after the meals, there's a possibility of reflux esophagitis or gastroesophageal reflux disease. Acidity comes back into the esophagus. So that would be not a good advice. Have extra calories with carbs and fats in the diet? No. Just because there is dizziness after meals, so would you like her to have extra calories and extra carbs? No. And take lots of fluids containing glucose and electrolytes? No, even that will worsen her symptoms. Why? Okay, first is, so therefore the option, the correct answer should be eat smaller meals of complex carbohydrates. So it will take long time for digestion of those and small volumes of fluids. Why is that? Because it's most likely a dumping syndrome, which she is suffering from now. Probably the surgery was partial gastrectomy, and after that there is possibility of dumping syndrome, and in dumping syndrome you advise this: eat smaller meals of complex carbs, let the food reach the duodenum, from the stomach to the duodenum, slowly. So that would be the best advice. We will discuss it threadbare, but let's see. If it's a 10 marker question for first prof level, then it would be explain the acid peptic disease or explain peptic ulcer, whatever it could be. Basis for surgical treatment, why this particular treatment is advised in which patients, and pathophysiology of her symptoms. So let's see now. Explain the disease. Now look, we are talking about the stomach, and there is secretion of HCl in the stomach, and this apart from HCl, acid and pepsin, which are the aggressive factors. These are called as aggressive factors. They are aggressive. They are likely to cause auto-digestion of the stomach wall. They are likely to cause peptic ulcer. There is defense mechanism also against this. Normally, there is a layer of mucus on the stomach lining. Then there are bicarbonate ions on this mucus. So there is a balance between the aggressive factor and defensive factor. And if this balance is tilted in the favor of aggressive factors like hyperacidity, pepsin, etc., and it weakens the defense mechanisms, then there is likely to be injury to the gastric mucosa and resultant peptic ulcer. So that's in summary what happens and what leads to the condition called as peptic ulcer. Ulceration, is any breach in the continuity of epithelium. So in this case also, continuity of gastric mucosa is breached, resulting in peptic ulcer. So that was the first part of our answer. Now, coming to the main part, and that is the surgical treatment. Look, for peptic ulcer, for hyperacidity syndromes, acid peptic diseases, there is medical treatment available. Of course, there can be antacids, there can be H2 blockers, there are other drugs like proton pump inhibitors. And since peptic ulcer, it is a common dictum, once a peptic ulcer, always a peptic ulcer. And therefore, sometimes the surgery is advised. Here, probably the surgery was partial gastrectomy. Some part of the stomach is removed surgically. So, partial gastrectomy. Sometimes along with vagotomy. Vagus, is it causes secretion of the HCl. Vagus is stimulatory to the digestive tract organs. Their secretions are increased by vagus, and therefore gastrectomy is often associated with vagotomy and also pyloroplasty. Well, now let's focus on the partial gastrectomy which was performed here. What is the advantage? What benefit this surgery offers? Physically, it removes the ulcerated area. I have shown it diagrammatically here. Let's say there were peptic ulcers in the gastric mucosa in this area. So when you remove this part surgically, that part is gone where there were ulcers. It reduces the acid producing capacity of the stomach. So ulcers are removed, and since you are removing the wall of the stomach, you are also removing the parietal cells which secrete the HCl. So you are reducing the acid producing capacity of the stomach, and also it diverts the food away from the ulcer site. So food will be diverted. It will not get stored as normally happens, and it will not irritate the ulcerated areas. You have removed that part. So food will be diverted straight away. It will reach the duodenum. So that's the surgical treatment. Now let's come to the crux of the matter. What happens after this kind of surgery? Look, you have removed a part of the stomach. What was the function of the stomach? To store the food, to solubilize the food, convert it into chyme, and then send it very slowly to the duodenum. Slow emptying of the stomach. That was the function of the stomach. Now you have removed a major part of the stomach, partial gastrectomy. What is the possibility now? Possibility is called as dumping syndrome. So this case is of dumping syndrome. As we have said here, stomach stores the food and slowly releases the chyme into the duodenum. It also normalizes the tonicity, and these two things are hit. They will be gone if you perform this partial gastrectomy. They are likely to be gone after the partial gastrectomy. So let's look at this factor further, the dumping syndrome. Now it's clear that the case is probably of dumping syndrome. Let's explain it further. If you are a first prof student, carbohydrates and hypertonic fluids are dumped into the duodenum. Dumping syndrome. So those from vernacular medium may just understand this term little better. Dumping syndrome. We dump something, if you know this. So same way, since the stomach has been, part of the stomach has been removed, that storage function is no more available, and your foodstuffs, whatever meals that you eat, they will go very rapidly and they will be dumped into the duodenum very rapidly. So that's the dumping syndrome. Now, since carbohydrates, your other nutrients, they are being dumped into the duodenum, and also the hypertonic fluids. See, when we consume the hypertonic fluids, their tonicity is normalized in the stomach, and then it is sent forward into the duodenum. So if you have done gastrectomy, even the hypertonic fluids, they will not stay in the stomach, they will straight away reach the duodenum. And that's what happens in the dumping syndrome. Now there are two parts of the dumping syndrome. early dumping syndrome which occurs in 10 to 30 minutes after the meal, and it occurs because of hypertonic contents reaching the duodenum. Stomach has been removed, some part of the stomach, major part of the stomach has been removed, so the fluids cannot be normalized, or normotonic fluids can't be made. The hypertonic fluids reach the duodenum. What happens here? Hypertonic contents reaching the duodenum, and since they are hypertonic, obviously they will pull water. They will pull water from where? They will pull water from the blood vessels which are in the lining of the duodenum. So in the wall of the duodenum there are blood vessels, and water will be pulled into the duodenum, into the cavity of duodenum, into the lumen of the duodenum. So water is pulled out of the blood vessels towards the hypertonic contents. It means what? It means the blood volume will suddenly decrease, and decrease in the blood volume will cause the sudden decrease in the blood pressure, and therefore the symptoms like dizziness, like palpitations, because there may be a hyperactive sympathetic discharge. In response to this decreased blood volume and blood pressure, sympathetic overactivity may occur, and there would be palpitations, sweating, etc., even nausea, vomiting for that matter. So that's early dumping syndrome, and it's because of the hypertonic contents reaching the duodenum, because you have removed some part of the duodenum. I beg your pardon, some part of the stomach has been removed. So they straight away go, they are dumped into the duodenum. The other one is late dumping syndrome. The other phase is called as late dumping syndrome. This occurs 1 to 3 hours after the meals, and it is because of the hypoglycemia. Yes, it is because of the hypoglycemia. What happens is glucose and carbohydrates are dumped into the duodenum after the partial gastrectomy. Part of the stomach has been removed, so stomach cannot store the food normally, and therefore carbohydrates, they will reach straight away into the duodenum, or carbohydrates, glucose will be dumped into the duodenum. Now, because a lot of carbohydrates are straight away dumped into the duodenum, they will be absorbed. The glucose will be absorbed rapidly into the blood. There will be a glucose spike in the plasma, in the blood. Spike of glucose. Suddenly the blood glucose level will rise. And in response to that, the insulin secretion will increase. Suddenly there will be hyperinsulinemia, and insulin secretion will increase. What will be the effect of insulin? That's most important. Insulin will start pushing the glucose into the cells. Blood glucose, which has increased, there is a spike. Now insulin will come and it will push the glucose into the cells. That means what? Suddenly the blood glucose will begin to drop drastically, dramatically. And this will result, this is what is hypoglycemia, and the symptoms can also be explained due to the hypoglycemia. Insulin has decreased the blood glucose to a much greater extent. So this is the second part of the dumping syndrome, phase 2 you can say, which occurs 1 to 3 hours after the meals, and therefore ask the patient to have complex carbohydrates, so it takes little more time to settle in the stomach, little more time for digestion, and then slowly goes into the duodenum. Not simple carbohydrates, they will not need any digestion, they will be straight away dumped into the duodenum. So instead, have complex carbohydrates, have smaller meals, so that glucose spike does not happen. Suddenly a massive rise in blood glucose will not happen. And fluids also, don't take too many fluids, too much amount of fluid, and that too hypertonic fluid, salty fluid. Avoid that as much as possible. That would be the advice to this particular patient, and that was the case for this particular video.